Estasyon maaasahan, mapagkakatiwalaan.
Live to PC Long Road of Cavite, AYOX #1 broadcasting channel, and you're watching ROSE News Patrol. Philippines' most influential news channel, the place where the news never gets old.
The right place, the right time. Always on the latest.
Truth is our priority. The power of information.
Moving closer to your world.
Companion. Continuous. Connected. Watch us work for you.
The voice, the agents.
We are the anchors that will bring you the hottest and the latest news of the hour.
Hello, Emilians. Hello, nurses. We are live na live worldwide via satellite.
Reliable organization that serves excellence. ROSE News Patrol. For the headlines, the proper assessment of glossopharyngeal nerve and vagus nerve or cranial nerves, night and them. We have Edmar, Vela, Sayal, and Leika for more information.
In this part, we will discuss and demonstrate the assessment of the 9 and 10 cranial nerves, namely glossopharyngeal nerve and vagus nerve. Together, CNs 9 and 10 carry visceral afferent signal from vascular baroreceptors and supply the pharyngeal musculature. With CN10 providing the majority of this supply, each nerve additionally performs the additional separate tasks indicated below. Since CN9 and CN10 communicate with nuclei in the dorsolateral medulla, both flow through the jugular foramen and are contiguous throughout section of the neck. They are difficult to clinically identify and frequently impacted jointly.
Cranial nerve 9 or glossopharyngeal nerve. Your mouth and throat get motor or sympathetic and sensory signals from it. One of the nerve's numerous jobs is to elevate your throat to make swallowing easier. The brainstem is where these nerves originate. They attach to various muscles, organs, and other parts of your mouth and throat. There is one of these nerves on each side. Deep inside your neck, close to the back of your throat, the glossopharyngeal nerve terminates. It has a variety of uses, one of which is swallowing. One of the few nerves in your body with 3 different types of fiber is this one. Motion is made possible by the motor. When tissues and organs are not in use, our sympathetic nerves help them to rest. Sensory give you the ability to feel things so you can taste, touch, and feel temperature. Take a sip, say ah, examine voice and cough, use the pressor to touch and flatten the back of the tongue on both sides, and check the gag reflex. Use a wisp of cotton and touch soft palate.
The vagus nerve, also known as cranial nerve 10, is the longest cranial nerve in the body and has both afferent and efferent motor and sensory functions. The nerve travels widely throughout the body, impacting number of organ system and body parts, including the heart, gastrointestinal system, the tongue, and the pharynx. There are numerous clinical connections of vagus nerve because to its extensive distribution throughout the body.
The 9th glossopharyngeal and 10th vagus cranial nerves are frequently assessed simultaneously. When the patient speaks "ah," observe whether the palate rises symmetrically. The uvula is lifted away from the paretic side if one side is paretic. Bilateral absence of the gag reflex is common among healthy people and may not be significant. It can be seen when the tongue blade is used to touch one side of the posterior pharynx, then the other. Coughing is typically brought on by suctioning the intratracheal tube in an intubated, non-responsive patient. The vocal cords are examined if hoarseness is noticed. A search for lesions such as mediastinal lymphoma aortic aneurysm, compressing the recurrent regional nerve should be initiated if the hoarseness is isolated and the gag reflex and palatal elevation are normal.
Before we proceed to the cranial nerve assessment, first we must know what the proper medical hand washing is. Medical hand washing is an important element for infection control. It is the most effective measure in reducing the risk of transmitting infectious diseases. First step of the proper hand washing is wetting our hands with water. Second, apply enough soap to cover all hand surfaces. Third, rub hands palm to palm. Fourth, right palm over the left dorsum with interlaced fingers and vice versa. Fifth, palm to palm with fingers interlaced. Sixth, back of fingers to opposing palms with fingers interlocked. Seventh, rotational rubbing of left thumb clasped in right palms and vice versa. Eighth, rotational rubbing backwards and forwards with clasped fingers of right hand and left palm and vice versa. Ninth, rinse hands with water. Step 10, dry hands thoroughly with a single use of towel. Step 11, use towel to turn off faucet. Lastly, your hands are now safe. And now, we can proceed to the cranial nerve assessment.
Assessing 9th and 10th cranial nerves. The patient is asked to utter a or ka in order to assess the motor division of cranials 9 and 10. There shouldn't be much nasal air escape, and the palate should rise symmetrically. Because the normal side of the palate is pulled up higher, when there is unilateral weakness, the uvula will shift toward that side. When one side of the palate is weaker than the other, there will be noticeable nasal air escape. The gag reflex assesses cranial 9 and cranial 10 sensory and motor systems. By pressing the tongue depressor on the back of the pharynx and observing the elevation of the palate, this unconscious reflex can be observed.
Abnormal findings in assessing the 9th and 10th cranial nerves. There is an abnormal amount of nasal airflow. The patient speaks up because the right side is weak. The left side elevates more than the right, and the uvula deviates toward the left. Right, 9th and 10th cranial nerve in this patient are not functioning properly. When the patient's left side of the palate is contacted with the tongue blade, the gag reflex is elicited. With the left side of the palate is rising higher than the right, and the uvula deviating to the left, both of which are consistent with the right cranial nerves 9 and 10 deficiency.
Well, that's the story, folks. Glad we could get together. Again, I am your favorite anchor, Kyle Beltran.
And your beautiful partner, Tiffany Faustino.
Your most trusted anchors, delivering nothing but the 24/7. Again, this is ROSE News Patrol, reliable organization that serves excellence. ROSE News Patrol.